Okay, let me address this very important issue, which is politicians getting the vaccines. What the committee that Adham and I chair right now are doing in terms of the prioritization list is risk assessment. I don't look at you and say you're a politician, you should get it first or last. I look at you, I look at your responsibilities, and we analyze how your risk assessment about how likely it is that you can become someone who spreads the virus. That's the risk assessment. Or whether or not you are likely to get the disease, should you be infected. These two things are very important. When we decide on the priority list, one is we decide, are you likely to develop COVID-19 if you are infected by SARS-CoV-2, and are you likely to suffer from it, i.e. possibly die from it. That's why countries have prioritized all people, because the data shows that they are vulnerable from the worst effects of COVID-19, as well as people with comorbidity, heart disease, diabetes, cancer patients, etc., or respiratory disease. So on that, you'll be prioritized. The other one is, how likely is it for you to be infected and spread? So frontline workers, we have to prioritize because there's been thousands of frontline workers who've been infected. So by the same token, politicians will be assessed on that basis. How likely is it that a public official is likely to be infected or to infect others? So we'll go based on, close contact, how often you see people, how often you meet the public, how often you go into public spaces. If you ask me today, I would argue that you guys, media, also priority. Look at this. Yeah? So the risk assessment must be based on those criteria. Cannot be, politician dapat, this dapat. It's not so much your job title, but it's the risk assessment about whether or not you can get sick, die, or whether you can be infected.